අනුරාධපුරය එහෙමත් නැතිනම් රජරට වැව්බැඳි රාජ්‍යය අපේ රටේ වසර 2500කටත් එහා ඉතිහාසයේ ජීවමාන සාක්ෂි රැසක් අදටත් රැඳී ඇති අපේ පළමු රාජධානියයි. ලෝක සිතීමේ තිතක් වූ ශ්‍රී ලංකා ද්වීපේ එදා විසුවන්ගේ දෙනුමේ තරම කියාපාන ස්තූප ගොඩනැගිලි වාරිතාක්ෂණය අදටත් ලොවේ බොහෝ දෙනෙකු මවිතයට පත් කිරීමට සමත්. මෙවන් මනරම්පුරයක කිසිවෙකුටත් නොදැනී නොපෙනී මහා ව්‍යසනයක බිජු දළුලමින් වැඩෙනවා. ලීෂ්මෙනායසිස් අපට කනට නුහුරු නමක් වුවත් මෙය ලෝකයේ නිවර්තන කලාපීය රටවල බහුල එහෙත් අවධානයට ලක් නොවූ රෝගයක්. නුපුරුදු ලෙස හැඟුණද පළමු ලීෂ්මෙනායසිස් රෝගයා ශ්‍රී ලංකාවෙන් වාර්තා වූයේ 1992 වසරේදී. වැඩි කල් යාමට මත්තෙන් ශ්‍රී ලංකාවේ බොහෝ ප්‍රදේශ පුරා මෙම රෝගය පැතිර ගිය අතර අනුරාධපුරය ලීෂ්මේනියා අවදානමට ලක් වූ ප්‍රධාන දිස්ත්‍රික්කයන්ගෙන් එකක් ලෙස හඳුනා ගැනුණා. විශේෂයෙන්ම කෘෂිකාර්මික දිවි පෙවතක් ගත කරන රටේ ආර්ථිකයට දැඩි සවියක් වන ශ්‍රී ලාංකීය ජනතාවට ඉතා දැඩි බලපෑමක් ඇති කරවන මෙම රෝගයේ සමාජීය ප්‍රතිවිපාක හඳුනා ගැනීම සහ ඊට කඩිනම් විසඳුම් සෙවීමේ අරමුණින් ECLIPSE ව්‍යාපෘතිය ක්‍රියාවට නංවනු ලබනවා. එක්සත් රාජධානිය බ්‍රසීලය ඉතියෝපියාව සහ ශ්‍රී ලංකාව එක් කරමින් අන්තර්ජාතික ව්‍යාපෘතියක් ලෙස ක්‍රියාත්මක කරනු ලබන මෙම වැඩසටහනට ශ්‍රී ලංකාව තුළ මූලිකත්වය ලබා දෙනු ලබන්නේ රජරට සරසවිය මගින්. අනුරාධපුර දිස්ත්‍රික්කයේ තලාව පදවිය සහ නැගෙනහිර නුවරගම් පළාත් කේන්ද්‍ර කර ගනිමින් මෙම වැඩසටහන ඉදිරියට ක්‍රියාත්මක වනු ඇති.
Traditional arts in Sri Lanka have always been closely interconnected with the health of its people. Art has been ingrained into the way of life from its very beginning, right to the end. Serving to optimize the physical, mental, social and spiritual well-being of people. Lullabies are sung to the babies from the day they are born, stimulating their developing senses while calming the baby and the mother as well. When harvesting, the farmers would sing and move their bodies to the same rhythm, harvesting the paddy, while sometimes the boomadier would add music, making harvesting look like a theatrical performance. Art also helped the villagers to bond, communicate and avoid exhaustion while at work. Life was so full of arts to the point where it was not merely a component of life, but the way of life itself. In addition to the cultural installation of art in day-to-day life, distinct healing rituals such as the Bali and Shanti Karma use different forms of arts, including drawings, sculptures, singing, music and folk theatre to heal diseases or promote health. Sanniyakuma, Ratayakuma, and Devolmadu Shanti Karma are performed to bring relief to people during times of calamities, illnesses and pandemics. Meanwhile, Sokari and Kolam are used as mediums of communication to deliver messages wrapped in humor and entertainment. Over time, it has evolved to a new structure and accommodates discussions on timely themes. Since arts have been inherent in the culture, we reached out to the art traditions to explore how modern health problems could be addressed through them.
We as the Sri Lankan ECLIPSE team conducted rich qualitative studies including ethnography such as participant observation, diary studies, patient booklet studies, in-depth interviews and creative community workshops to see how social construction of cutaneous leishmaniasis takes place in the context of villages in Sri Lanka. The observations in this study reveal the pain and suffering faced by people with cutaneous leishmaniasis, the problems they face during the patient journey, and also the barriers that led to delay in help seeking in this particular disease.
A preserved cultural preference for message communication through acts and dramas was also evident during community engagement and involvement. In designing our interventions, ECLIPSE Sri Lanka blends its research findings with the efficiency of traditional art in delivering lasting messages to improve community awareness on cutaneous leishmaniasis in Sri Lanka.
Kolam was developed using the insights we gathered from working with the communities. When we started working with the communities, one of the things that we realized was our communities they still long for the traditional ways of entertainment. They were talking about Jahuta, they were talking about Kolam, they were talking about street dramas. So this is how the idea for the Kolam was born. And the ECLIPSE team, the Kolam artists and the community all came together in developing this creation. We identified the myths and misconceptions that needed to be addressed about leishmaniasis. We also incorporated the public health messages into this Kolam, and we sat down with the Kolam artists and developed the script using the everyday words that these community members use, using simple messages, using simple language. So this is how the Kolam was developed. It was a collaboration between the team, the artists and the community.
Actually, within ECLIPSE, we tried so many different new things. Especially, we were interested in finding out what would work best to involve and engage communities to work towards combating cutaneous leishmaniasis. Actually, our ECLIPSE communities were quite different from each other. So they always came up with different motives, they had different priorities, and always they had been suggestions. So in line with that, when we asked from one particular community what kind of strategies would work out to gather community around ECLIPSE, so they suggested that we can start off with an environmental protection initiative, because their priority was to protect and clean the village tank, which they considered the heart of their village. So with that, they gathered up as a team, they took the first initiative and they talked to different stakeholders in the local authorities, and with that, they could take the first step towards protecting their environment. So that was their priority. In contrast to that, the other community suggested that we can start off with the medical exhibition to grab people's attention towards ECLIPSE. Likewise, their interests were different. So from the beginning, it was not all about leishmaniasis, but in certain cases, we had to start with people's priorities and concerns.
Hello everyone, I'm Lanka, PhD student in the ECLIPSE program. In ECLIPSE, I had this sterling opportunity to engage with people. My research laboratory was a society which included people from different socio-economic, political and cultural backgrounds. We worked in 3 different study settings to achieve a common goal. One of the key fundamentals of ECLIPSE is empowering the community through education. As a PhD student, I engage with people, decision-making groups, CADs and other key informants in those areas.
Exposing to a wide range of community members allowed me to enhance my soft skill throughout the process. I understood the key strengths and barriers along with the challenges confronted by the team due to various factors. We noticed that changing attitudes regarding thinking and behavior is a critical factor that drives us to overcome such problems and achieve and sustain the vision we anticipate from the community. So as the decision makers at the community members volunteering to work as well as the school health teams visited the medical faculty of the Rajaraj University of Sri Lanka for a leadership program that self-directed them to achieve a common goal via educational empowerment along with the soft skill needed for such a change. I observed the transformation of these changing agents after participating in the program. They implemented various programs to achieve the common goal based on context-specific principles. One of the communities distributed leaflets by visiting homes in the area and giving key health messages to the community, while the other community approached it via already established official communication channels such as incorporating disease awareness to ongoing government service and also through community-based organizations like death and benevolent societies. The experience I gained from the ECLIPSE will be a core foundation of my future.
Being a research assistant in ECLIPSE was a wonderful opportunity to witness and learn on how to work with different community groups. The school community was one of our main stakeholders. When we asked them how they could improve community awareness, they came up with the novel idea of creating street dramas. This turned out to be a very effective way to get our message across. They used the information of ECLIPSE education materials about cutaneous leishmaniasis to create their own scripts for these dramas. They didn't just make these scripts on their own, but they also worked with the community to plan and perform them. One of these street drama was performed in their local community, then moved on to the nearest city and even got shown at the Rajaraj University Medical Faculty. It ended up on national TV, which really shows how community-led efforts can make big impact and keep the message going strong.
In today's advanced world, communication is largely driven by the internet and modern media platforms.
However, new media alone wasn't sufficient for our efforts as our target audience resides in rural area of the Anuradhapura district. To effectively reach this population, we adopted a multi-dimensional approach combining traditional media, mass media and new media. This comprehensive strategy allowed us to communicate our message in this most impactful way possible. Traditional media played a significant role. We utilized a variety of methods including notice, posters, leaflet, public speaking, loudspeakers and both small and large group communication. We also tapped into pre-existing community communication networks to amplify our message. Recognizing the power of the art, we incorporated creative formats like street dramas, short films, short storybooks, animation and documentaries to make the message both engaging and memorable.
මේ විකාරද දීලා පාඩම් කරනවා
Our reach was further extended through the collaboration with the national television channel, national and regional radio channels, and prominent newspapers where we featured to publish awareness more broadly. Finally, we leverage modern communication technologies such as YouTube and WhatsApp, using these platforms to distribute essential information and reach a wider audience. All of these elements combined make ECLIPSE a uniquely captivating and impactful project, demonstrating the power of an integrated approach to public health and community engagement.
මා මනුෂ්‍ය මම මේ ECLIPSE ව්‍යාපෘතියේ ග්‍රාමීය සමාජිකයෝ වගේම ව්‍යාපෘති සමාජිකයෝ විදිහට වැඩ කරනවා. මේ ව්‍යාපෘතියෙන් ගමට එකතු වෙච්ච වටිනාකම් ගැන මතක් කරනවා නම් මුලින්ම කියන්න ඕන අපේ ගමේ බාල මහලු තරුණ කියන පරම්පරා තුනක් එකට එකතු කරන්න පුළුවන් මේ ව්‍යාපෘතිය හින්දා. ඉතින් මේ ඇති කරගත්ත බැඳීමත් එක්ක අපිට පුළුවන් වුණා අපේ ගම වෙනුවෙන් ලොකු වැඩ කොටසක් කරන්න. මුලින්ම අපි ගමේ හැමෝමත් එක්ක එකතු වෙලා ගමේ ලස්සන ගමේ වටිනාකම් ගැන මුළු ලෝකෙටම කියන්න පුළුවන් ලස්සන පොතක් ලස්සන වීඩියෝ එකක් අපි නිර්මාණය කරා. ඒක ඇත්තටම ගමට ලොකු වටිනාකමක් එකතු කර වැඩක් වුණා.
විල්බඳි දනවුව රජරට පුරවරය ඓතිහාසික අනුරාධපුර රාජධානිය තලාව ප්‍රාදේශීය ලේකම් කොට්ටාශ එප්පාවල නගරයට යාබදව පිහිටා ඇති කටියාව ඓතිහාසිකමය වටිනාකමක් සහිත ප්‍රදේශයකි. ශ්‍රී ලංකාවේ පළමු අග්‍රාමාත්‍ය ටී.එස්. සේනානායක මැතිතුමන්ගේ ගොවි ජනපද ව්‍යාපාරය යටතේ 1948-49 කාලවකවානුවේදී කටියාව ගොවි ජනපදයේ පිහිටවන ලද බව ඉතිහාසයේ සඳහන් කරනවා.
වගේම එදා ඉඳන් අද වෙනකන් අපේ ගම තුළ ලීෂ්මැන්සිස් රෝගීන්ගේ ව්‍යාප්තියත් අපිට සිතියම් ගත කරන්න හැකියාව ලැබුණා.
මම ලක්ෂානි රණතුංග ECLIPSE ව්‍යාපෘතියේ පර්යේෂණ සහායිකාවක් හැටියට වැඩ කටයුතු කරනවා. අන්තර්ජාතික ව්‍යාපෘතියක පර්යේෂණ සහායිකාවක් හැටියට වැඩ කටයුතු කරන්න ලැබීම අපිට ලැබුණ ලොකු අවස්ථාවක් හැටියට මම දකිනවා. ඒ වගේම තමයි අපි ගම් එක්ක වැඩ කරද්දී ගම් තුන මූලික කරගෙන පොත් තුනක් නිර්මාණය කරන්න අපිට අවස්ථාව ලැබුණා. ඒ පොත් තුනට තේමා වෙලා තියෙන්නේ ඒ ගම්වල සමාජ සංස්කෘතික හා ඓතිහාසික සාධක. පොත් තුන එළි දැක්වීම සඳහා අපි යොදාගන්නේ අපගේ අන්තර්ජාතික පර්යේෂණ කණ්ඩායම ලංකාවට පැමිණෙන අවස්ථාවයි. අපගේ අන්තර්ජාතික පර්යේෂණ කණ්ඩායම පිළිගැනීම සඳහා ගම්වල ප්‍රජාව බොහෝම උනන්දුවෙන් වැඩ කටයුතු කරා. ව්‍යාපෘතිය විසින් සිදු කරන ලද කෝලම ප්‍රදර්ශනය කිරීම, ඒ වගේම ගම්වල ප්‍රජාව එකතු වී පැදුරු සාජ්‍යයක් සිදු කිරීම වගේ ලාංකීය සාම්ප්‍රදායික ක්‍රම වලින් තමයි ඔවුන් පිළිගන්න සූදානම්ව සිටියේ.
As the Sri Lankan ECLIPSE team, our intervention strategies involved multi-dimensional, multifaceted approaches. The communities of practice or the COPS group played a pivotal role designing and implementing these activities. Our COPS team included top officials from health, agriculture, education, rural development, media and public administrative sectors. Through the COPS members and their downstream channels of officials, we could effectively and conveniently reach the baseline communities, that is the general public. For example, the chief administrative officer in the region, the district secretary, paved the way through divisional secretaries to the Grama Iladaris, the most important immediate official contactable to the public. This network was immensely helpful for us to reach the community, to disseminate health education material as well as related activities. Also, the district agricultural committee headed by the district secretary, which composed of different levels of public administrators and agricultural committee leaders, was another solid network to execute these activities. Being an agriculture dominant region, Provincial Director of Agriculture and the working network made strong inroads into communities. Similarly, the rural development officers and the Ayurvedic community field officer networks were excellent sustainable gateways to reach communities towards effective delivery of healthcare information. And most importantly, the role of health sector officials.
They really established a very good system to take part with their intervention, especially Department of Health. They really developed some very important sensitization and orientation program for grassroots level officers who really deal with this disease.
To deliver leishmaniasis related key health information to general public, we as the ECLIPSE team could work together with the Provincial Director's Office to make some key policy decisions. To list some: circulation of key guidelines and regulations on management, prevention and control of leishmaniasis among all medical officers and healthcare institutions in the region, and setting up a sustainable arrangement to train healthcare workers categories including medical officers, laboratory technicians and public health inspectors to strengthen efforts to control of leishmaniasis. Moving forward, the establishment of central diagnostic services for detecting leishmaniasis at the teaching hospital to facilitate prompt confirmation and treatment of patients. These are a few examples of how the existing administrative and public service networks efficiently involved in handling leishmaniasis in the region in a sustainable manner through the mediation of ECLIPSE Sri Lanka.
ECLIPSE වැලි මැසි වදුරේ දුටු නුදුටු පැතිකඩ සොයා